Hello viewers, welcome to the Island Health View, a program designed to bring you matters related to health in Dominica. I am your presenter, Rima Alfred. This program will be brought to you on SAT TV this and every Friday. In this segment, we will focus on the Chikungunya virus and give you an update on the present status of the virus on the island. We will also give a few important tips on how you can prevent the spread of the disease and how to keep your environment safe. Stay with us.
Hey Carmen.
Hey Brianna.
What's wrong with your face?
Harold is sick.
Harold?
Yep, Harold my friend.
What's wrong with him?
I don't know, he started complaining of fever, of backache, of headache, of muscle pain. He feels like he wants to vomit. If I didn't know better, I think Harold is pregnant.
Pregnant?
I'm just joking. He has chills, he has pains all over. You know, I also saw a rash right on his foot.
A rash, you say? Really?
You know what the worst part is? He has joint pains and he feels like he has arthritis. Harold cannot even put on his clothes.
Whoa.
Whoa.
That's bad.
Serious.
Well, you know what I think?
Tell me.
I think Harold may have chikungunya.
Chick? No. He doesn't have goat well. He just has muscle pain.
No, I didn't tell you about a chick or goat well.
You said chick?
I said chikungunya.
Oh.
That's the new viral disease that's in Dominica right now.
Huh.
It's almost like dengue fever. However, it's not dengue fever.
So hold on, that means it's a mosquito disease?
Yeah, it is, indeed. I heard the health officials talking about it on the radio. That's how I know.
You know, if you heard it on the radio, we need to go see the environmental health officer because Jim Jones and I, we sleep in the same room. And Harold is not giving me any chikungunya disease.
Well, I think we should go now.
I think so too.
Hi, I am Zilma Charles, Environmental Health Officer. The best way to prevent chikungunya virus infection is to avoid mosquito bites. This will help to prevent further spread of the virus. In order to prevent mosquito bites, you should wear long-sleeve shirts and long pants. Use mosquito repellents such as citronella oils or cream or insect repellent sprays. You could also use mosquito coils and vape mat, but pay attention to how you use the coil so that you don't cause a fire by accident. Cover with mosquito nets while you are sleeping. Avoid visiting your friends' homes if they are sick with the chikungunya virus. If possible, avoid going to areas where the disease is present. Stay in air-conditioned or cool areas if possible. Mosquitoes do not like cold temperatures. Keep your environment clean and do not store water around the house. If you must, then make sure that the container is covered so that mosquitoes don't get in to breed. Remember, your health is your responsibility.
Welcome back. Chikungunya is a viral disease carried by the Aedes aegypti mosquito and causes dengue-like sickness. Symptoms include a sudden high fever, severe pain in wrists, ankles or knuckles, muscle pain, headache, nausea and rash. Joint pain and stiffness are more common with chikungunya than with dengue. Senior Officer for Vector Management of the Environmental Health Department, Clement Marcelet, said the department has put in place an intensified response to the virus. He said this was done due to the fact that there is no vaccine or immunity for the virus.
From inception, the Environmental Health Department noticed that we needed to put in place an intensified response towards the chikungunya virus, bearing in mind that there is no vaccine for this particular disease and that there was no exposure to the disease in years gone by. Therefore, we noticed that every individual would be at risk since there was no form of immunity to the disease. Hence, we were able to increase on our activities, as I said earlier, to mount up a rapid response towards the disease. The National Pest and Termite Control was responsible for doing the chemical control aspect, whereas the environmental health would be the monitoring agency.
He said an integrated vector management plan had been put in place This ensured that the vector was controlled via biological, chemical, and physical means. He also informed us that there were a total of 3,720 cases, with 167 being confirmed and 3,553 being probable cases.
We did so by doing an integrated vector management plan, by ensuring that we control the vector by biological, physical, and chemical means, and also bringing on key stakeholders within the communities, like local governments, community-based groups, the church, and other community-based organizations to help us attain this goal. The cumulative number is 3,720 as of September 6. That's the information I have. 3,720 cases, of which 167 were confirmed and the others are probable cases.
Marcelaire informed us that the department received positive responses from the public in being willing to assist and getting the issue resolved. However, as the outbreak continued, a few myths came up which posed a new challenge to the department, hence leading to them educating the public more on the virus and prevention.
We found that people were very willing to assist the department in especially in the cleanup campaigns, where we found some local truckers offered their services. However, as the outbreak continued, you realize there was certain myths coming up, where there was that disbelief that the Aedes aegypti vector wasn't responsible, and that posed a new challenge, where we had to do even more education to members of the public, because we realized that due to these conceptions, the people would not really take action in the right action. But however, we saw individuals who took it as a responsibility and put great emphasis on controlling the virus, and hence we were able to gain some success.
He also stated that at present there has been a 5% decrease in the vector indices, as well as a significant decline in the cases of the virus reported on the island.
Of late, we have noticed that there's a 5% reduction in the vector indices on island, which is the household index, which simply states out of every 100 houses that were inspected, 12 were found positive for breeding of the mosquito. This reduction has been able to allow us to evaluate the entire action that we have taken, or the response we have taken in regards to Chikungunya virus. We can attribute it to some degree towards the decline in the number of cases that we have seen of late, and there's a significant decline in the number of cases reported to the health centers, and that indicates that we have, as the Ministry of Health has gained have a creditable degree of control of the virus on island.
During a visit to Grand Bay by the Ministry of Health, an individual from the village who had chikungunya said during her experience she had a very high fever and joint pain as well. However, she did not let this stop her from her gardening business.
I had a lot of fever. Imagine, my daughter wasn't going to school, but she told me, "Mommy, something tell me to come up." And she came up, and she put ice under my arm, both arm, head. Fever was high, but when to get up, the get up was a problem. But the fingers pain. In my fingers. Up to now, I cannot even touch the grass with my finger. I have to put gloves with the garden, because gardening is something I love, and I give it all my all. That's my business.
And now, a short message from the District Medical Officer and Team Lead of the Roseau Health District, Dr. Lenora Favre-Drago, on the Chikungunya virus.
We've been speaking about the chikungunya outbreak for months now. Everybody's been educated and re-educated on staying safe. I would like to add to that, not only chikungunya is affecting us, but this is the season for dengue fever as well. So we did not neglect the fact that we have the Aedes aegypti mosquito, which can transmit both diseases. So you get the chikungunya virus and the dengue virus being superimposed into just the one mosquito. So that is dangerous. We're here at Jolly's today, and behind me you can see a group of over-the-counter drugs that you can go on the shelves and buy to help reduce some of the symptoms of chikungunya. Again, I will say the symptoms of chikungunya because they in no means eradicate completely the disease. However, they can help you to alleviate your symptoms and feel a lot better.
Island Healthview is supporting the Senior Officer of Vector Management at the Department of Environmental Health's message to the public to keep the environment clean as possible to prevent the further spread of the virus, keeping in mind our health is our business.
Although we have seen a reduction in the number of cases, it doesn't merit us reverting to what we used to have. This has now provided us with an opportunity to ensure that we gain control of the Aedes aegypti mosquito, which is the one responsible not only for chikungunya but for dengue virus. We need to ensure that our practices on the emergencies would remain with us. We would ensure that we clean regularly, we pay specific attention to stored water, and we call the Environmental Health Department for advice as regularly as possible. Remember, your health is your responsibility.
And that's all, folks, for this edition of Island Healthview. Be sure to join us next Friday for another edition. Until then, I am your presenter, Rima Alfred. Thanks for watching.